Ashley Bateman. I'm born and raised here in Southern California. I grew up just over the other side of the hill. My father is a physician, has been out in Malibu for about 30 years with UCLA. And I just came back from Chicago. I was training at Cook County and Loyola in Chicago for the last few years. And I now am working over at Thousand Oaks, and I just left the Westlake office with UCLA. So I've been out here now since last summer, which it's a wonderful community, and I'm getting to meet a lot of wonderful people out here. So we're gonna go through getting active with arthritis and what we're gonna do to kind of help ourselves with exercise and with activity, and how we can do this on a day-to-day basis so it's not a huge imposition, because people say, let's go out and exercise. Well, what does that really mean to you? You know, the doctor says, well, you need to exercise a few hours a day, and you're sitting there going, yeah, okay, but that's really not going to ever happen. Or you're going to have to exercise and go out for a run. Well, that's not ever going to happen. You know, you don't have the motivation to do it. So one of the things we need to do is figure out how we're going to motivate ourselves. So what is it that we can do to motivate ourselves? Well, one of the things is that exercise itself is going to help our arthritis. It's going to help us feel better. It's going to help us with any of our medical problems, whether it's diabetes, hypertension, whether it's just overall aging, or whether it's just getting back into shape. So the exercise itself helps with energy and motivation. So just briefly, we're going to touch on what is arthritis. So arthritis actually just means inflammation of the joints. And as I've talked to a few people, there's various types of arthritis just here that people are struggling with. Some of it includes rheumatoid arthritis, osteoarthritis, and gout. And everyone's arthritis symptoms are going to be different. Okay, all of the pains and the aches, they're going to be different and individualized to each individual person. So it's an estimate that about 50 million Americans have been told by their doctors that they have some form of arthritis or another. So that's a pretty huge population out there. So what are the symptoms? We've all kind of had it, even if it's just not arthritis. It's the joint pains, the stiffness, and the swelling. So who's at risk for having arthritis? Well, pretty much anyone. As we get older, our risks of arthritis increase. And as women have a tendency to have more arthritis risk factors than men do. And then certain genes cause you to have more arthritis predisposition, or a more likelihood of a chance to develop it in the future. So what are the things that we can do to change our risk factors? What are the things that we actually can modify? Because we can't change the first three. So our weight, getting our weight down. Some of my patients come in and they're like, well, my doctor tells me I have to lose 25, 30 pounds. Well, that's really great for your doctor to say that. But if we think about walking around the room with 2 cans of soup, 1 in each hand, if we can just take 2.5 pounds off each leg, that'll make a huge difference. And that's a pretty reasonable goal, just to get down 2.5 pounds. Another thing is joint injuries, the kneeling on the ground without knee pads. We've all done our gardening and crouched down on the ground. Repetitive running, anything that's high impact, okay? Infections also, if you do get a red hot swollen joint or something that you think is just not right, or a joint pain when you have fevers or anything like that, make sure you go in and get to see your doctor and find out. And then occupation with repetitive knee bending and squatting. So all of these things are things we can modify in our own lives that can decrease our risks of developing arthritis. So rest your joints. That's been said in the past. Those days are out. Those days are over. We now know that physical activity both reduces pain, it improves your energy, it improves your function and mobility, and it'll help you with your mood, your ability to sleep well, and most of all, overall, your quality of life is going to go up. So physical activity is actually the arthritis pain reliever. One study has shown that walking can be just as effective in reducing knee pain as naproxen, that's Aleve, or ibuprofen, which is also known as Advil. Anyone have any questions so far? All right. So we're going to get active now. We're going to talk about aerobic exercise and aerobic activity. So 2 hours, 30 minutes a week of moderate intensity activity is what we need to get active, to help improve and get us to the improved quality of sleep, the improved energy. And it seems a little bit much when you're looking at it overall, but you're going to divide this up throughout the week. You're going to take a half an hour 5 times a week. That's it. You can't squeeze in a whole half an hour in one day, then we squeeze them in 10-minute blocks. Get up 10 minutes in the morning, 10 minutes at lunch, and 10 minutes before you go to bed. And it's only 5 days a week. If you get yourself up to vigorous exercise, then you're only at an hour and 15 minutes a week of exercise. Okay? So any combination of those works, and we use like a 2-to-1 ratio. So 1 minute of moderate exercise is equivalent, 1 minute of vigorous exercise is the same as 1 minute of 2 minutes of moderate exercise. The other thing we need to add in, muscle strengthening exercises and stretching. And then this needs to be about 2 days. And then for anyone who has any gait difficulties or any balance problems, we need to do muscle strengthening that helps promote balance. Okay. So what does aerobic exercise mean? Does anyone have any ideas?
Would that consist of yoga too, maybe?
Mm-hmm. So the whole point of aerobic exercise is just to get your heart rate up. So you should be exercising till you're sweating, until your heart rate goes up, okay? So any activity that makes your heart beat faster and harder while you're sitting, standing, or lying, okay? So you can do these from your chair, you can do these standing up, you can do these lying down. So if you start sweating and your heart rate is in your exercise mode and beating a little bit faster, this is aerobic or cardiac exercise. This is heart healthy exercise. So what are moderate intensity exercises? Just a couple of them up here, and there's many more, and it also depends how you end up doing them. So we've got our yoga. We've got going out dancing, ballroom dancing, wonderful. You really get your swing step going and you really step it up to more vigorous exercise. Swimming is also moderate. Tai Chi, wonderful, wonderful for arthritis, wonderful for balance. I use a lot of Tai Chi for rehabilitation for arthritis. And then skiing and sports, mowing the grass and heavy yard work, right there in your moderate intensity activity. And if you can't do any of that, go out for a brisk walk. So what's our vigorous exercise? Vigorous exercise can have a little bit more high impact on the joints, but as we look, swimming will not have a high joint impact for our arthritis. Jogging and running does. Some people tolerate jogging and running really well with their arthritis. Others don't. Tennis, another great vigorous exercise. And then some of the more running associated sports. And like we said, getting your dancing up to a more vigorous swing dance. We've got it all the way up to vigorous activity. All right, so a few things to remember. Any activity is better than none. So you say, I can't even manage the 30 minutes a day, 10 minutes a day. Anything you can do is going to be better than nothing at all. And moderate to low impact activity is safe for people with arthritis. All different types of arthritis. Okay? And this activity is in addition to your usual daily activities. So you say, well, I walk all day at work, or I'm walking around all day. So I'm already doing 15 to 20 minutes. You need to add your exercise on top of that. We can't cheat and use, our daily little things that we do. We just add it in. So it's a little bit extra. Okay? And like we said before, you can't do 30 minutes all at once. Go ahead, add 10 minutes 3 times a day, and you've got 30 minutes right there. Okay? The more you exercise, the more health benefits you're going to get. Okay? And the benefits are going to far outweigh the risks. So what is smart exercise? So today we want to focus on smart exercise. How are we going to initiate our arthritis-friendly exercises? So the key thing, start low and go slow. That's our S for smart. So that means when we start off, I want to go out and train for the marathon, and I haven't seen the gym probably about 3 or 4 months. So going and running about 4 miles tonight really would not pay off very well for the weekend. I'd have to start training, start in small increments. Okay? Modify the activity when your arthritis symptoms flare. So you did your 30 minutes yesterday, and now your elbow is killing you, and you've got horrible arthritis in your elbow. You're going to have to back off on that elbow. You can work other things, but back off and modify your activity to tolerate your exercise. okay? And we talked a little bit about joint-friendly activities, okay? So we don't want high impact. The running on the knees is going to be a little bit hard on the knees. So we don't want a lot of activities that are really hard on the joints. Some of the activities we'll go over today can be a little bit more high impact on the knees, but basically whatever you can tolerate is going to be the best type of exercise for you, okay? Recognize safe places and ways to be active. So if we're going to go for a walk, walking down the busy streets, probably not as safe as getting onto one of the paths and away from the cars, especially if we have balance issues or things like that where we're scared we're going to trip, fall, or anything like that. Making sure we're not walking on the uneven sidewalks. We find a nice trail or a track to go walking on. And then most importantly, any concerns, talk to your doctor or any certified exercise specialist prior to starting your exercise. So, pain, it's going to happen. What do? Soreness and aching when you start to exercise is normal, but there's certain things that aren't. So what we're going to do is we're going to modify it. So modify frequency, that's how many times a day we do it, and the duration, how long we do it until the pain gets better. And then we can slowly build up and slowly work up to a level of exercise that we can tolerate. Change the types of exercise up. If you find one exercise really starts to bother that elbow or that shoulder or the knees, try and find something else. I switch a lot of patients with knee pain over to water aerobics, and they don't have the impact of walking on the treadmill or running outside, okay? Making sure that you're warmed up before you start exercising. Come on in.
Sorry, got late here.
That's okay, come on in.
Come a long way.
That's okay, we're glad to have you. So making sure that you're warmed up properly. Make sure you do your stretches. Cold muscles, you go out and start exercising them, are going to be much more sore the next day, okay? And then making sure your exercise is at a level you can tolerate. If you're out walking with your friend and you can't keep your breath up and you can't continue your conversation, you need to back off. You should be able to continue your conversation while you're exercising. Might not be totally easy, but you should not be completely out of breath, okay? Oh, and good comfy shoes. The high heels never work very well for exercising. Okay, when do you see the doctor? Okay, pain that is sharp, stabbing, and constant. Those are never good pains, okay? That needs to be reevaluated. Back your activity off, make sure you go in and get evaluated, make sure that nothing else is going on, okay? You should not limp, okay? If you have a baseline limp, with your knee pain and stuff like that, and it starts to get worse, that's also something that needs to get evaluated, okay? And any pain that lasts more than 2 hours, so you get sore after you exercise, you get sore from running, and you do your stretches and you do your cool down, but if you're still really having pain a couple hours afterwards, or it's waking you up at night, this is not normal. You need to go in and get evaluated, okay? And pain that's not relieved by medications or hot and cold packs, okay? Large increases in swelling in the joints or joints that feel hot and red. Anything that's red, warm, and swollen is a very angry joint. So some of the other things we can do for pain are, I like to recommend, like we talked about here, ice or cold packs, Icy Hot. A lot of the over-the-counter topical Icy Hot, warm baths, anything that's supportive. A lot of people don't want to take a lot of the medication, but Tylenol is the #1 medication for osteoarthritis if your doctor has said it's okay to take. And if you don't have any other medical problems, you can also take some ibuprofen or Aleve as well. I can't do this. I don't have enough time. Well, you can. 10 minutes. 10 minutes when you're talking on the phone, because you should be able to carry on a conversation at the same time. Call your friend, call your sister. Talk to her on the phone, and we'll talk about a couple exercises you can do just while seated or standing. Okay, you're afraid of the pain. Well, you need to see the doctor then and have them reassure you that your arthritis is okay to exercise with. If you have trouble with balance or you're scared about balance, you might have to get in and see the physical therapist first so that they can work with you on what types of exercises are going to be the best for you. Okay, so now for the active portion of our activity. We've got a couple exercises that we can do. These are going to be pretty much easy exercises that you can do just around the house. Okay, so I decided not to do the yoga today, but one of them is going to be the pendulum swing. And So we'll put the picture up for a second. What you're going to do is you're going to have a chair or you're going to put something else in front of you to kind of balance yourself. And you're going to grab hold and you're going to lean forward. Relax your head so you're not holding your head up and putting that tension on the back of your neck. And you're going to swing your arm. And you want it to be about the size of a dinner plate, okay? And you're just not forcing it, but you're just letting gravity kind of move your arm. And you can get your shoulder circles wider and wider. Okay, and then you can repeat and do this for the other shoulder.
How long?
Okay, so we're going to go to that. So you're going to do this 5 to 7 times with each shoulder. You can do about 10 to 15 circles. It's really going to depend on what you tolerate. You can build them up and to your tolerance level. If this arm gets sore, you're doing too much and you're going to want to back off. Okay, and then you'll switch and you'll go to the other side. Okay, if you have too much pain, leaning forward, stand up a little bit. And you can do them just standing up here. You don't have to lean all the way forward. Okay, another one is tendon glides. For those of us that get some pain and stiffness in our hands, okay, we're going to start out with our hands upright. And we're going to slowly, it's all about controlled movement, bring our hands all the way down into a fist. Once we get them nice and closed here, we just bring the fist down a little bit more. And it's slow and controlled, and then we roll them back up. And then we bring the hand down slow again, roll down into a closed fist, and bring it back up. So there's different amounts and times you can do this. It's going to be on what you tolerate. If you're doing it slow and controlled, your hand's going to already be tired after 2 or 3 of these. You might not be able to do 5 to 7 until after you've been doing them for a couple weeks or so. So then you'll switch to the other hand, keeping your fingers together, bring your fingers down, close them into a whole fist, and then slowly bring them back up. Another one I don't have on here is even just opening and closing your fingers. So bringing the fingers out so that they're spread and then closed. Out so they're spread and then closed. Anything that increases the motion in slow, controlled fashion, you can already feel your hands starting to warm up. Another thing you can do for the hands for arthritis is to buy the different putties. They have them at Target or Walgreens and some of the various pharmacies, and they have them in different strengths. And you use these to kind of just squeeze them, and they'll help you build up your hand strength. Okay, so another one, this one's a little bit harder for some people with the knee arthritis. But this is really good. If you can do it with your knee arthritis, this is very good for your knees because this is going to help build up your quads. So this is one of our strengthening exercises. So we use a tabletop or a corner or something we can balance on, and we're going to just go down as low as we can tolerate. If we can only bend a little bit, we'll only bend a little bit and hold it. If we can bend farther down, we bend farther down and we hold it for about 5 to 10 seconds. If 5 to 10 seconds is too long, back it off and make it shorter. You're going to adjust your exercise to what you can tolerate. Like we said, if you can do a little, that's great. If you can do more, that's even better. Okay, this is one of my favorite exercises to give patients for knee arthritis. And for ladies with purses, you even have an extra benefit. So what you'll do is you're going to sit and you're going to just raise your leg right out in front of you, keeping your knees nice and even. They should not be falling apart. And you're just raising your legs slow and controlled. And then hold it here when it's at the top, and then bring it back down. Keeping the knees nice and even together, hold it here, and back down. Well, you might think this is really easy, and you don't have a lot of weight going on. Well, if you're thinking this is really easy, and you're like, I have no problem, I'm doing this controlled, put your purse on the end of your foot, do it with a little weight on it. Then you're really going to have a lot more to work on. All right. So I just wanted to thank you all, and what you do today is going to improve your overall tomorrow. And I'm more than happy to answer whatever questions or take any comments you guys have, and I'll leave the floor open. Yeah?
Well, I want to thank you very much because some of this exercise I didn't know what to do or to practice, even though I take them, and I feel that it's very helpful because we could do some of them, at any time, like we're sitting, talking, watching TV or whatever. It could all still be done if we remember which ones to do. Same, can't have flyers passing out, with the instructions on them.
Mm-hmm. We can put some together for next time, I'm sure. Anything else?
I have problem in my shoulder. Do I have to put it into warm water or heat or anything like this?
So I'm really glad you asked about the shoulder. One of my favorite exercises I don't have in here is actually the wall climb. And what you'll do is you're going to come up, so you're just right next to the wall, and you're going to walk like a spider, your fingers up the side of the wall. Excellent. So then your shoulder still hurts. So what do you want to do? Icy Hot works really well as a non-in-the-mouth pain medication. Warm compresses alternated with cold compresses also would be very helpful.
Cold also? Okay, thank you.
Anyone else? Yes.
Yeah, I find walking is boring for me.
Mm-hmm.
Is there anything I can do at home that would replicate that?
That would replicate the walking?
Yeah.
So if the walking's boring, there's some yoga that also, you can buy one of the yoga instructional videos, or if the yoga's too slow, I usually recommend Pilates, can be a little bit more fast-paced. And you can just put one of the instructional videos on the TV. I find those can be a little bit more engaging, and you can switch them up with walking. So they can be kind of a combination of the two. The other thing is to just kind of alternate some stretching exercises and things in, or find some really fun walking trails. I know that you guys have a lot of...
Treadmill.
The treadmill is great. The treadmill is great, and so is the elliptical machine. Both of those will be much more low impact on your knees. You can put on a book on tape. I usually go to the gym and I put my books on tape on and I go on the treadmill for
Do you know anything
a while.
about the elliptical machine?
Yes, those are low impact on the knees. So if you have knee arthritis, the elliptical machines can be very good for your knees because they don't have the repetitive pounding. So they kind of give you a smoother kind of thing. And the hands move. The one thing with the ellipticals, make sure you're strapped in. The elliptical's a little bit harder to balance on than the treadmill because your feet are placed a little bit far apart and you're kind of on this wide kind of swinging thing. Yes?
Which medications are least harmful to your liver and other important organs?
Okay. So as far as the over-the-counter pain medications, there's tons. There's Aleve, and a lot of them have the same name and turn out to be the same medications. The ones that I have in my armory, or what I use every day, are Tylenol, Aleve, and ibuprofen. Tylenol tends to be a little harder on the liver if you have liver problems, and ibuprofen and Aleve can be a little bit easier. The problem is Aleve and ibuprofen can upset your tummy, so you have to make sure to take them with food. And if you're on a lot of different medications, even if it's over the counter, I always advise you running it by your primary doctor to make sure that everything's okay.
What about degenerative disorders of the joints? Is that something that these exercises do?
Yeah, they're the same thing. Rheumatoid arthritis, osteoarthritis. Osteoarthritis is degenerative joint disease. So all these arthritises that we're talking about today, gout even can be a degenerative type of joint disease. All of them can be degenerative, what that means is over a period of time, if you have arthritis, it can get worse. So that is the degeneration of the joint. And all of these exercises and this whole talk is specifically for degenerative arthritis.
I take glucosamine for my left knee, this hard a little bit. Is that good?
Yeah, so the FDA and the studies on glucosamine are still kind of back and forth, but my feeling about supplementation, if it helps you and it doesn't interfere with any of your other medical problems, then you can go ahead and take it, as long as it's helping you, yeah. Anyone else? Yes?
I have loss of cartilage in my right knee. It's in the forepart of the knee. So I can get on the exercise of the bicycle and pedal quite well. But walking and jogging is almost impossible, although I do try to walk. Now, the doctors tell me, try your best to walk. And of course, I got an enlarged heart at my age, that's common, I guess. And I have to sit down frequently. Does that harm in any way, or is there any way they can improve or put fresh cartilage in there?
Unfortunately, without doing a whole brand new metal on metal knee, that's what we have. There are some new injections called, there's some viscous injections that we put in the knee. They're all, except for the knee replacement, they're all short-term fixes. The knee injections that I do with the steroid injections, and the rheumatologists also do some, the joint injections with kind of the viscousy or the thick, sticky stuff that's supposed to help with the lubrication of the knees. Those are all short-term kind of fixes. As of right now, there's nothing we can do to fix the cartilage. But what I would recommend is if it really hurts to walk on the concrete or walk on the treadmill, walk in the water. If you can get to a pool, walking on the water, you're more buoyant, you're not putting the impact on your knees, and you're doing the same amount of exercise.
Does your facility have a pool at UCLA?
So UCLA does, but that's going to be down in main campus. We unfortunately don't.
In Santa Monica?
Yeah, but there are plenty of aquatic rehabilitation centers out here in the Westlake area.
Yeah.
Yes.
I was wanting to ask you about acupuncture. Does that have benefits to the joint?
A lot of people do have benefits from acupuncture. It's going to be person specific. And this is one of the things that goes along with over-the-counter or herbal supplements. If it works for you, acupuncture, there's not much harm from the acupuncture as long as you go to a licensed acupuncturist. And if you find that it's working for you, it can really do a lot of good. A lot of people I've had a lot of patients report back a lot of good things from it. Yes?
So I had a question. If you have osteoarthritis
Mm-hmm.
and osteoporosis,
Mm-hmm.
are these exercises still good to do, or do you put yourself
Yeah.
at risk more because your bones are not?
Well, so in fact, actually, so the question is about osteoarthritis and osteoporosis. Osteoporosis is the low bone density. And in fact, actually, the number one treatment to help you, well, not the number one, but one of the treatments for osteoporosis is going to be impact activities, making those bones stronger, doing your exercises. So actually, this would both benefit the osteoporosis as well as the osteoarthritis.
So it would be the same type of exercise?
Same type of exercises. What we touched on at the beginning is that this isn't just good for osteoarthritis or rheumatoid arthritis or gout in the arthritis, world. This is great for hypertension, diabetes, heart disease. This will help in the whole spectrum of your health and well-being. Certainly.
Okay, just to let people know, I know that the Y in Thousand Oaks used to have a arthritis class in the pool where we would do arthritis exercises, but I haven't been to it in a long time to check. And I know the Global Senior Center and the Moore Park Senior Center has arthritis classes, but called under different things, and they also have sort of other exercise classes that you can take. Global might charge, but I believe some of the Moore Park classes are free for the ones that don't know, have
Wonderful.
to get there. So just to lay down.
Thank you so much.
You're welcome.
We got a question over here. What's the best diet to follow?
Well, so when it comes to diet, it depends what your goal is for diets. What I tell my patients is any diet will actually work in the long run as long as you can stick to it. The one diet that I really think is a great diet is called the DASH diet. It's called the Dietary Approach to Stopping Hypertension. And the reason I like this, it's very similar to the Mediterranean diet. The only difference is the Mediterranean diet kind of adds in olive oil. But what I really like about the DASH diet is it's great for diabetics, it's great for hypertensives, and it's great for overall health. It teaches you portion control, it teaches you about salt. And the website is dash.org. And so this is the dietary approach to stopping hypertension, and it's just an overall well way to eat. So I think any diet is great as long as you can stick to it. So if Weight Watchers works for you, then you can stick to it, then go with Weight Watchers. If Jenny Craig's the one for you and you can stick to it, it really matters what you can stick to. Any other questions?
Now,
Certainly.
What if it isn't about weight loss, just about healthy eating?
So then as far as healthy eating, I think that, in the scope of this conversation, the DASH diet really gives you a good overview on what's good portions and how much meat and how much dairy and things like that. And they use the food pyramid, and they really teach, the website really teaches you about just dietary approaches.
And do you think upping the calcium intake is good?
For osteoporosis, yes.
Upping the calcium food intake rather than
Yeah.
pills?
Mm-hmm.
Okay, thank you.
Do you have exercise picture for people who wants to do, how to do it?
I do. I don't happen to have them with me today, but I'm sure we can get some of the pictures, of, at least from the talk, I can get those pictures off for you guys.
You
and I
leave
can
it at the desk?
Yeah, I can have them
Thank you.
dropped off. Mm-hmm. Yes?
Repeat what those letters stand for, dash.
It's called Dietary Approach to Stopping Hypertension.
Do you have any literature on it?
Literature on the DASH diet. I didn't bring any with me. I am very computer oriented and I'm very green in my clinic, so most of my information's on the computer unless I print it out. So it's dash.org is the website, but I can get some information over here.
Are you going to give it to them?
Yes, I can give it to them. Yeah,
Thank you.
not a problem.
Question, what's the remedy? Sometimes your fingers kind of getting deformed from arthritis. It happens with a lot of ladies.
Yeah, so it's going to be, that's kind of comes over time. It's going to be doing the exercises and making sure, it really depends on the type of arthritis and the type of the deformity. If it's more of the rheumatoid conditions, then those need to make sure your rheumatoid arthritis is being well treated.
How could you, is there any way of finding out what type of arthritis is it?
You would see your doctor and your rheumatologist, and they would be able to diagnose you with your specific type of arthritis. Mm-hmm. Anyone else?
Well, if you're doing osteoporosis,
Mm-hmm.
are like hip replacements out of the question then, or done because you don't have strong enough bones?
Not always, not always. I think it would definitely be kind of dependent on what's all going on with your specific situation, and it would probably be a question more for the orthopedist. Anyone else?
I'd sure like to have a copy of your presentation.
Alrighty, I have one with me, but that's it. I can leave that one with you, and I can get some more for you.
You can also send it here. They can probably make a copy there. You can send it over to
Mm-hmm.
folks here at the center.
Okay. Anything else? All right, well, thank you guys so much for having me, and I really appreciate it. Thank you.